Welcome back. We're talking to Kimme Evermann about Medicare fraud. So now, Kimme, I want to get into a little different vein on here.
Okay.
Can you tell us if there's a fee associated with having the new Medicare card?
Absolutely none.
Okay.
No fees. So, and I'm so glad you asked that, Janet, because I know that what we're going to have is people who are running scams about, you have to pay this fee or that fee. Absolutely not.
Okay.
And if you get that in the mail, rip it up, throw it away. If someone calls you, hang up.
Okay. So the premium payment deduction that's made, how will that change at all during this transition?
Nope, nothing, and that's what's so great, and that's, we're just hoping and hoping that it'll go really smoothly, and so far it has been.
Okay.
But there will be very few changes other than let's keep our beneficiaries safer by taking their Social Security number off of a card they use frequently.
Okay, so that leads me to another problem. We know the Social Security number isn't going to be on there anymore,
Right.
but there still will be information on there that could be used by scammers for
Right.
fraudulent purposes, right?
Right.
Okay.
Well, and I think it's important to remember that people who are scammers, if we foil them one way, they learn another way to conduct their chaos. And so we need to still protect that card, but there will be a number on it. That's your claim number. And even though the other, your Medicare claim number is random, I'm sure there will be scammers out there. So just protect it.
Okay. So going along with that, if somebody should damage their card or accidentally throw it away, what should they do?
Well, a number of things. And
Okay.
actually, to go back to your last question, I also want to add that in addition to keeping it safe, you want to be sure that you're checking your Medicare notices that you get,
Okay.
So that you can see whether anyone has ever used your card for something that you didn't have done or a doc you didn't see. The same place that you might look for that information is where you might go if you lose your card or throw it away, and that's the mymedicare.gov website.
Okay.
And that is part of the medicare.gov website where most beneficiaries who've been around Medicare for a while, they've used that really good website. It's
Okay.
very informational, and the My Medicare is their secure account with their private information that no one else can get to. And once they have that account, they can go there and order a new card if they need to. They can also, Janet, find out the status of, has their new card been sent out?
Oh, perfect. That's really good information.
Yep.
Okay, so I kind of want to go back to the phone calls.
Sure.
I know some people get what we call a cold call from somebody who might be offering goods or services through Medicare. What should people do if they get a call like that?
I would say that you should always ask that person to put it in writing if they want to send you something, and then hang up the phone.
Okay.
You never know, they may not be scams at all, but you just don't know, and you have to protect yourself.
So on that, how would someone know if they were getting a legitimate call, somewhat like maybe their Medicare Advantage plan?
Well, I would say again, call up your local SHIP counselor. We look at that kind of information for beneficiaries every single day. I get, I would say, several emails a week from folks in the field asking me, is this a real company? Is that a real company? We do some research, we find out for that person, and they can go with being informed instead of wondering or guessing.
Okay. So when people are reporting potential Medicare fraud, I think you said they could contact you, but are there other authorities that you would recommend that they contact?
Absolutely, and I think even better than maybe your local SHIP counselor would be our local SMP program, which stands for Senior Medicare Patrol. Same number, we can put it up on the screen, so it's a real easy way to get a hold of them, and they will help you. And they are a totally free of charge program who just want to help keep Medicare fraud down as much as possible.
Okay. I want to switch from the telephone to the TV. A lot of times we'll see those commercials where people are promising to get services and maybe equipment at a cheaper cost. And so are those legitimate, and should people be avoiding calling them, or is that an okay thing to do?
Well, you know what sprang to my mind is dental does that a lot, where people think they're buying dental insurance, and what they're really usually buying, Janet, is a discount card.
Oh,
so you know they're usually on the up and up. It isn't that, but you're not. They imply sometimes that you're getting insured when you're not. You're getting a 10 or 20% discount card. You may have to buy from a certain person or excuse me, a certain organization, and in order to even use that discount card. Again, call either your local SHIP or SMP, and we'll check it out for you.
Okay, and then really quickly, one last one, the mail. A lot of times we get unsolicited mail with the same type of thing. Would you give people the same advice for handling that type of advertising?
Yes, either that or get yourself a good shredder. I have two. And we get so much junk mail, and I just shred it and take it to the recycle bin.
Perfect. Thanks so much, Kimme.
Absolutely.
You've given us some really great information.
It was great to be here.
Okay. Up next, we'll be talking about healthcare fraud with an investigator from the Montana Insurance Commissioner's Office. Stay tuned. We'll be right back.